Hello, my name is Zoya Farahmanifar. This is my student IT. Now I'm gonna show the completely the room. Now I sanitize my hand and don my clean gloves and give my stethoscope both sides. Hello, my name is Zoya Farahmandi. I'm a nurse student. Can I check your birth rate? Could you please tell me your name, last name, and date of birth?
William Winter, 1933, 11 December.
Thank you. Today I'm going to do your head-to-toe assessment. Are you okay?
Yes.
Now I'm going to check the room for the safety of my patient. It's perfect. Do you feel any pain?
No.
Do you need to go to bathroom?
No.
Okay, close the curtain. And I'm going to start with the physical appearance. Physical appearance is matched with his age. And could you please stand up? Thank you. And body structure is matched with his age and is symmetrical, and skin color is matched as genetic background, and height and stature is appropriate his age, and position and posture is upright and sitting on the chair and erect, and his behavior is good mood and relaxed, and his eye contact is he can maintain his eye contact, his speech is intact, and his clothes is according with the weather, and his personal hygiene is kept intact, and his breathing is effortless and unlabored. There is no sign of short of breathness, and level of conscious is alert and awake. Now I'm going to do for orientation. Please tell me what is your name?
William.
Where are you now?
Hospital.
What is the date today?
The date is March 13.
Thank you. And my patient is oriented by three: place, person, and time. Now I'm going to do inspect head and facial. There is no discoloration, no lesion, and there is no masses, no scar, and now I'm gonna do the test cranial nerve number 7 and facial nerve. Could you please smile with teeth, without teeth, and raise eyebrows? And okay, thank you. And please frown. And please puff your cheek with resistance. Thank you. Please close your eyes tightly, and I want to pull on your eye and by resistance. Sorry. Okay, thank you. And now I'm gonna inspect for eyes. Eyebrows are symmetrical, and upper and lower eyelashes is even lashes distribution. No discharge, no crusting. Could you please close your eyes? No lid line, no ptosis, and now I'm going to check the sclera. The sclera is white with a pinkish blood vessel. Now I'm going to check for conjunctiva. The conjunctiva is appropriate pinkish red blood vessel, and red blood vessel is present. And now I'm going to check, I'm going to do for the test cranial nerve number 3, oculomotor. Now I'm going to measure the pupils of my patient. Please open your eyes. Thank you. The pupils are approximately 4 millimeters in diameter, and round and symmetrically bilaterally. Now I'm going to do the test for constrict on direct and reflect to the light. Okay, thank you. And now I'm going to do the accommodation test. Could you please say at the tip of my finger? My patient is able to conjunctive and constriction and convergence, and the pupil is round and symmetrical bilaterally, and constriction and convergence and consensual. And cranial nerve number 3 is intact. Now I'm gonna check for ear. The color is matched as genetic background. There is no excessive ceremony. Okay, and the ears, the appropriate shape, symmetrical, no lesion. And then I'm going to check the nose and sinus. The nose is midline. The sinus is, there is no crusting and no discharge, no redness, and passageway is appropriate. Now I'm going to check the mouth and the pharynx. The color of lip is appropriate, moist, there is no sign of dehydration. And now I'm going to do the test cranial nerve number 9 and number 10. Number 9 is glossopharyngeal, number 10 is vagus. Could you please open your mouth and stick out your tongue? And when I say you, please say ah. Please say ah. Okay. I was able to see soft palate and uvula is midline and able to raise. Then now I'm going to do the test cranial nerve number 12 is hypoglossal. And could you please open your mouth, stick your tongue, and move side to side. Okay, thank you. And please put it to your mouth and to the back. And please say tight, light, and dynamics.
Light, tight, dynamic.
Thank you. And my patient is able to say light, tight, dynamics, and move his line side to side, and the tongue is midline, and cranial nerve number 12 is intact. Now I'm gonna check for the neck. The neck is symmetrical, midline, and there is no lesion, no discharge. Now I'm gonna palpate your neck and stand up the back of the patient. Please let me know if you feel any pain. Now I'm gonna palpate thyroid. There is no obviously enlargement thyroid. Do you feel any pain? No pain, no tenderness, no masses. Now I'm gonna check for trachea. Trachea is I find the trachea and is one side and up, and the other side and this side and one up. The trachea is midline and there is no shifting in trachea. Now I'm going to check for carotid artery pulse, and each side by separately for 15 minutes and multiple by 4. And the other side. The carotid artery pulse is 68 beats per minute, regular and strong rhythm, and grading to pulse and equal bilaterally. Now I'm going to do the test cranial nerve number 11. Could you please shrug your shoulder by resistance? Thank you. Could you please turn this side and the other side your head? Okay. Now could you please by resistance and look at me? Thank you. And for the other side, could you please by resistance and look at me? Thank you. The cranial nerve number 11 is intact. Now I'm gonna do assess for upper extremities and cover lower extremities. The upper, now I'm gonna do inspect. There is no discoloration, no lesion, and even hair distribution, and symmetrical. And then now I'm gonna palpate. Could you please bring your hand? If you any pain, please let me know.
No.
No pain, no tenderness, no masses. Now I'm going to check for temperature. Would you please bring your hand? The temperature is appropriate with the races of body and the room and appropriate. Now I'm gonna do for radial pulse. Both of radial at the same time and simultaneously. Radial pulse is 68 beats per minute, regular strong rhythm, and gradient 2 pulse and 2 plus, and then equal bilaterally. Now I'm gonna do a grip test. Please bring your hand and squeeze my hand as much as you can at the same time. Thank you. And grip test is appropriate and the strength is symmetrically bilaterally. Now I'm gonna inspect the lower extremities and cover upper extremities. Could you please bring your head? And the legs, the lower extremities are symmetrical, no lesion, no discoloration, and hair distribution is even. And now I'm gonna palpate lower extremities. If you feel any pain, please let me know.
No.
No pain, no tenderness, no masses. Now I'm going to check for temperature. The temperature is appropriate with his body and room, and then the bulk muscle is appropriate and the moisture muscle is appropriate with his age. And then now I'm gonna inspect for posterior and thorax. Could you please? The exposed posterior thorax, there is no lesion, no discoloration, symmetrical, no masses, and then now I'm gonna palpate the posterior thorax. If you feel any pain, please let me know.
Okay. No.
No pain, no tenderness, no masses, and now I'm gonna auscultate 12 points. Okay, please take deep breath in and out when the stethoscope touch your skin.
Okay.
Thank you. In and out, in and out, in and out. I was able to hear this, the sounds of brachiovesicular, and the vesicular is present, and then there is no cracking, no wheezing, no striders. Now I'm gonna inspect the anterior thorax. Could you please turn me? Now I'm gonna inspect. I have to measure for the respiratory rate. Could you please just normal breathing? Thank you. The respiratory rate is 17 beats per minute, strong and regular and strong rhythm, and there is no sign of shortness of breath. The breathing is short, the breathing is unlabored, and there is no appropriate. Now I'm gonna do for auscultated apical heart. Apical heart is in the mitral valve and fifth intercostal space left to the midclavicular line. Now at first I have to landmarking and find a sternum and I'm following the midclavicular and then going and coming down, and it's here, and auscultate the apical. For 30 seconds. I was able, I heard S1 and S2, no damage, and the apical heart was 68 heartbeat, and S-rank and rhythm, and regular, and there were no S3 and S4, no murmur. Now I'm gonna ask you, please lay back on the bed. Now I'm gonna assess the abdominal, and I have to put the pillow underneath the patient, okay, and cover of my patient except the abdomen. Thank you. Now at first I have to inspect the abdomen. The abdomen is symmetrical, no lesion, no discoloration, no stripe, no scar, and now I'm gonna auscultate the abdomen. At first I have to start the lower right abdomen. And after I have to start at the lower, the right lower abdomen, and moving to the right upper abdomen quadrant, and to the move to the upper left upper quadrant, and to the move to the left lower quadrant. The bubble sounds are present in 4 quadrants, and high pitch cascading gurgling, the sounds 5 to 30 seconds per minute. And now I'm gonna light inspect, light touch the 4 quadrant. Please let me know if you feel any pain and tenderness. And now I'm going to start the right lower quadrant and move to the right upper quadrant, and to the move to the left upper quadrant, and to the move to the right to the left lower quadrant. Do you feel any pain and tenderness? There is no pain, no tenderness, no superficial masses, no rigidity in the 4 quadrant. Thank you so much, and your examination is done. Please waiting for your physician. Thank you.